Columbia Morning on KFRU. We welcome the Dean of the School of Medicine at the University of Missouri, Stephen Zweig, who we have talked to many times, but it's been way too long since we last had a chance to talk to Dr. Zweig. We welcome him now. Thank you for joining me today. How are you, sir?
Well, I'm doing great, David. It's really nice to be with you again.
I
remember the many wonderful conversations we had over the years with our dear and now departed friend, David Oliver.
Yes, we talked many times, and especially with the emphasis on people as they age and what some of their needs are and what some of the ways that they can stay active. You've had a very good career with geriatric care. So my question to you is, what are you seeing now in regard to some of the concerns? I'm not asking you as the dean, I guess, of the med school right now, but as a physician, what do you tell, because those of us who are over 60 and some of us are quite a ways over 60 at this point in time, we're the high risk individuals. So what are you seeing in geriatric care in the age of COVID-19?
Well, so I still am practicing as a geriatrician, and because of the increased risk of this infection, it creates some special challenges. So, an 80-year-old is 20 times more likely to die from a COVID infection than a 20-year-old is. So I think continuing to follow the guidelines recommended by our public health experts to keep distance from other people, at least 6 feet, to wear masks when in present with others, to continue to wash your hands frequently, to try to get out of the habit of touching our nose and our mouth and our eyes, because that's all the ways in which viral infections are communicated. We have, I think that group of people tends to be among the most careful in our population. And, we just have to do all that we can do.
You got me on that just a moment ago, because I was sitting here listening to you and I had my hand up on my chin, as I oftentimes do. And so immediately it went down, because it's one of those things we're asked to change some of the practices that we've done for most of our life sometimes.
Absolutely. Shaking hands is something that was such a part of the way we greeted and communicated with people, and yet I believe that's a behavior that we're really going to have to put aside for the foreseeable future.
So as we look at this community, which is such a nice mix of older residents and the young people who come in and bring a certain vibrancy, as a physician there, are you concerned about what will happen as young people come and they are more carefree and they've heard the news also? Well, if I get COVID-19, I'll probably not have any real serious symptoms. I understand there are exceptions to that, but I'll just go about and live my life, and what happens, happens. And then you've got those who are 70, 75, 80, 85 who say, please, don't live that way. I guess, as you just said a moment ago, social distancing, just not going to places where you might have to cross paths, would be the best thing for older people.
I think that's really the safest way. We've done a lot of work to make our practices safe for our patients, because, of course, older patients have other health problems that need to be managed even during a viral pandemic. And, so we've moved the sick people to other settings of care so that we can care for older patients and other patients in our redesigned clinical environments. And other than going to the doctor when you need to, or brief trips out to the grocery store with the proper public health approaches, it's probably best for us, for the most part, to stay away from other people as much as possible. Not surprisingly, that creates problems with loneliness in a lot of older people. A lot of my patients who have been very conscientious about protecting themselves and others have truly missed their interactions with their children and their grandchildren. We've been really successful in the long-term care facilities in Columbia and reducing the number of cases, because that's the group that's, of course, at the highest risk. And it's just really being scrupulous in all ways to take care of oneself, to wash hands, to stay apart, to wear masks, and to do the best we can. They've had to, of course, limit visitors, and by reducing social interactions. That's really one of the great challenges that many of my particularly older patients, older than you for sure, have experienced.
We're talking to Dr. Stephen Zweig. He is still a family physician and focuses oftentimes on older patients, but he is also the dean of the University of Missouri School of Medicine, has been that on an interim basis since April of 2019, and then took over as a permanent appointment a year later. So my question for you is, what was the difference between taking over? I don't mean necessarily just responsibilities, but I'm talking about the atmosphere around a med school like MU's med school, comparing April of 2019 to April of 2020. What changes?
Well, it's really been dramatically different. It's certainly an honor for me to be the dean of the medical school that's meant so much to me, and to be able to work with many men and women who make our medical school a great one. And I believe that our people responded quite seriously and successfully to the changes that had to happen. When I look back, near the end of March, MU suspended all in-person classrooms. And the AAMC, which is our national organization that guides medical education, recommended that all clinical experiences for medical students stop. So both were decisions to protect the health and well-being of our students. And we responded immediately. All the in-person classes were changed to live Zoom sessions involving the students and faculty. We replaced much of our in-person care with video visits between doctors and patients. And then we invited students into that interaction. So sometimes doctors, patients, and students were talking with each other, but often in 3 different locations. And then finally, as we became more confident in our ability to protect both students and patients, we invited them back into the hospital and clinics for the care that we could provide. So we literally adapted overnight. We worked with innovative and creative solutions within the limits of this pandemic. And I think we succeeded through the patience and determination of both our students and the faculty.
Being a physician or being in healthcare industry is such a traditionally a hands-on occupation and profession. So it had to be very hard, I would think, for students who knew what they were signing up for when they said, I want to get to med school, all of a sudden to be distanced that way, because I don't know if I were a student in that kind of a situation, if I would feel, hey, I need to be better at what I want to do for my career. I need to be there in person.
Well, we've certainly made a number of adjustments to try to make up for any of those differences. And it's the students are still excited and highly motivated. Mm-hmm. And these are all very smart and capable people who are committed to this goal of becoming physicians. And we continue to work on strategies to enable them to be successful. We had over 3,000 applicants for our class of 128 this year. And our students that are going to be starting next month, about 85% come from Missouri, 21% are from rural areas, 17% are people who are underrepresented or minorities in medicine, and 27% are from economically disadvantaged families. So this is a wide spectrum of people, particularly from our state, who really made the commitment to do this and are going to be working with us, just like medical students all over the country are working within their own medical schools to do the best they can within the circumstances, given the innovations that we've developed.
Yeah, who knows what it'll be like as they continue through their careers. But you're right, we've seen a transformation in the way medical care can be delivered and be delivered successfully. And I think in the past, Missouri's med school, University of Missouri's med school has done some things that were ahead of the curve on some of these things.
That's true. We've really had an innovative curriculum in terms of problem-based learning curriculum, and where the medical students learn in small groups with a faculty facilitator to care for patient problems in a real-world context. We've also introduced students in the past to in-person patient experiences early on in their career. And this strategy has helped us a lot. There was a study that came out last year which showed that our students perform much higher than they would be expected to based on their prior credentials. And the authors concluded that it was in large part due to our innovative curriculum.
Well, I hope that continues. I think that it will under your leadership. And again, I'm so glad to hear that there are so many who are really fired up and charged up to enter this profession, especially during this time when we're going to need it so much in a new and changing experience, and they're not backing down from the challenges. That's good to hear.
That's really true, David. And we are excited about the students that we have working with us and excited about the new ones that are going to be joining us just in the next couple of weeks.
So good to be able to talk to you again. Thank you, and best of luck to you. Congratulations on being appointed as the dean, and good luck there at the University of Missouri Med School. Thank you, sir.
Well, thanks, David. I love working every day to advance our mission, which is to improve the health of all people, especially Missourians, through exemplary education, research, and patient care.
Very good.
That's what we'll do and continue to do.
Well, that's good to hear. Dr. Stephen Zweig, who is the Dean of the MU School of Medicine, has been our guest. Thank you again.
Thanks, David. Great to talk with you.
This is Columbia Morning at KFRU.